I think that the most exciting story from my perspective is the story of ocrelizumab. And in a larger sense, our increasing appreciation of the role of B cells in the pathophysiology and now in the therapy of multiple sclerosis. The story is a very long one, and the story involves more than 2 decades of increasingly sophisticated preclinical animal work, which initially defined the role of the humoral immune system in demyelination, and then translation of these discoveries to people with MS, and the appreciation that the humoral immune system, and B cells in particular, were especially important in the pathophysiology of tissue damage in people with MS. And this then led to a very strong partnership that has lasted for more than a decade between Genentech and Genentech Roche and numerous academic collaborators that resulted in the translation of these preclinical and early clinical findings into what we hope will be a marvelous new therapy for people with all forms of MS. There have been wonderful advances in treatments for people with MS over the past 25 years. And these have been great good news for people who have MS, because these therapies have translated into a far more favorable long-term course for most people with MS. The problem with the current therapies for relapsing remitting MS is that they are only partially effective. And those that are a bit more effective are less safe for use over the long term. What is most exciting about ocrelizumab is that it appears to be dramatically effective against all parameters of disease in people with relapsing MS, and that it is quite well tolerated over the 2-year period of the trials. And this will likely translate to an even more benign course of relapsing MS going forward. We believe that progressive MS and relapsing MS are identical. They are genetically identical. They are, in terms of the tissue damage, identical. And yet, there are clear differences because our patients with progressive disease haven't responded to the therapies that are clearly effective against relapsing MS. So what is thrilling about the ocrelizumab data, in addition to the effect size for relapsing MS, is that the door is now ajar for progressive MS. And for the first time, we have a therapy that is clearly effective, although only partially effective. I think that all decisions in clinical care are based upon the physician's recommendation, but even more important, the patient's decision, based upon risk tolerance, understanding of how important the problems related to the disease are to that individual person. So it is hard to predict what the individual decisions will be, but I think that there is likely to be massive adoption of ocrelizumab because of its clear efficacy and safety record, at least thus far, for people with progressive MS. My hope is that because the door's now open for progressive MS, there will be new energy, new octane, both in industry and in academia, a new realization that primary progressive MS and all forms of progressive MS are no longer black boxes, and we now have one important success that we can build upon. It's enormously encouraging for all of us. Progressive MS has been incredibly frustrating. It has been an incredibly frustrating problem for clinicians and a devastating problem for most patients. And for the first time, to be able to have something that truly works against primary progressive MS, this will create a new sense of hope and optimism for all of us.